This is a short instructional video to demonstrate how you can take a CBT note for your client. First, you're simply going to come to the appointment for the client in which you need to enter a note. Once you select that, you're going to see the click here to view session note bar. By picking this, we're going to open the note where you're going to see general information about the session, the kind of note it is. This is a CBT note. And then you're going to see the different boxes that kind of walk you through the session. So first what you're going to see is today's agenda, and that's actually going to pull last week's agenda items that you didn't get to complete forward, so you don't have to flip back or review the note beforehand. It's actually going to pre-populate right here. So last time it looks like it had been scheduled to conduct values clarification exercise, but we didn't get to it. So we have that ready to go. And then if we want to add anything else to the agenda, we can simply come here where it says type here to add to today's agenda. And so we might want to go ahead and set goals for upcoming weeks. Once we've conducted the values clarification exercise, we add that, and possibly we'll discuss how thoughts and feelings can interfere with behaviors if we let them. Now we come over to homework, and this actually shows us the homework that was assigned last session. So we can ask the client here, did you meditate for 5 minutes 3 times per week? And in this case, he says he did, so we check the box, and you can see that the homework completion rates automatically change right here. So today's completion rate was 100%, and overall the sort of historical completion rate's been 70%. If I wanted to see more details, I can simply come right here and look at that chart. Now, in terms of routine outcome measures, these are obviously optional, but they're a good idea for effective practice. If we come down and we look at those, these are all customizable, but some that are already entered here for this client is the weight, 173, his BDI score, 14, BAI is 22, AAQ 20, and the OQ 49. Now, if we want to see these in a table, we can do that. Likewise, we can also see these in a chart, and sometimes it's really powerful to show clients the progress that they've made with that visual. We can simply click this toggle here to get that out of our way to keep the note a little cleaner. I mean, come down to the note, and we can obviously just type anything we want freely to customize it, but we can also use these buttons as necessary to populate with auto text. But say we went ahead and conducted that values clarification exercise. Also discussed the impact of behaviors that have been incongruent with clients' values, and introduced the concepts of cognitive diffusion and acceptance. And then I might want to use a macro. Also went ahead and used a metaphor here, so went ahead and did the passengers on the bus metaphor, and that automatically populates by selecting that button. And then after that, went ahead and I set 2 goals with the client. Now, there obviously are other options, but we don't have to use them, which is we could look at interventions here and actually get a drop down and check boxes for what we did, if that's what you want to do. Or we can simply use the option we just had, which is to freely type them and use the buttons. The same goes for symptoms. There are typical symptoms under generalized anxiety disorder, depression, ADHD. Various options are available there by default, and you can also customize and add your own. Then we'll move down to the homework box, and what I'm going to go ahead and do is have the client continue to meditate 3 times per week for 5 minutes, and identify some committed actions related to goals that were just set. Next week, do some psychoeducation on mindfulness a little more, and maybe do mind train exercise. Now, if you need a psychotherapy note, you can certainly type in the box there if you want to add that additional information. Likewise, if you want to use a stylus or even a worksheet that you upload, you can do that in the diagram box. But again, those are optional. The main thing is that you're able to look at the agenda, and here we did conduct the values clarification and set upcoming goals and discussed how thoughts and feelings can interfere. So those are taken care of. So in our next agenda for the next session, it'll be blank because we covered everything. And then you simply hit Save Changes, and now you have finished your CBT note. As always, we like to hear from you. We're constantly trying to improve the software experience for you, your staff, and your clients. So if you have any questions, suggestions, or feedback for us, please go to mbpractice.com and go to the Contact Us page and share any of those there. We look forward to hearing from you.